Hi guys, and welcome to the discussion of the blood vessels. So today what we're going to do is we're going to start talking about the arterial system, and then we're going to mention the venular system. And you don't have to necessarily memorize these arteries, but we want you to be able to identify them based upon their landmarks. And there are a couple that are just going to be sort of intrinsic that you've probably heard of before. So we'll go ahead and get started there. So again, keeping in mind, arteries are going to be the vessels that carry blood away from the heart. So mostly what you're looking at here is you're going to identify them in red, but there are pulmonary veins that do not carry oxygenated blood. So they're highlighted in blue and they carry deoxygenated blood. Otherwise, for the most part, as a rule of thumb, if you see red, you're going to be able to identify it as an artery. So the aorta is actually the largest artery in the body, and that's what you can see here. There is a part that comes up in the ascending aorta, and then there's a lower component called the descending aorta that gives rise to the thoracic and the abdominal aorta. And what the aorta does is it gets that blood from the left ventricle and it gets it out to the rest of the body so it can supply those systemic arteries. Now, when we talk about the heart, again, we actually will see that there are many blood vessels that come off of this aortic arch. So again, this is what you see here. It's called the aorta, but this little arch is called the aortic arch. And what you'll see is that we have three major blood vessels that are going to come off of it. We have the common carotid artery, we have the left common carotid artery, and then we have what is called the left subclavian artery. So there are three major kind of give-offs, if you will, when it comes to this guy. And what ends up happening here is you see the left subclavian artery, the right subclavian artery is just branched on this side. Now, what you'll also notice too is, again, that you have these pulmonary arteries. And again, they're highlighted in blue because they carry deoxygenated blood. It's like the exception you need to know. Otherwise, most of them will be highlighted in red because they're carrying deoxygenated blood. But the left pulmonary artery and the right pulmonary artery are going to give off to the lungs. So that way we can do that gas exchange. And then down here, you're going to see the blood return to the left atrium via these right and left pulmonary veins. And they have two versus the pulmonary arteries only have one that are coming off. So just something to look at. Now, when we start looking in a little bit more detail about the major branches, again, of the aorta, remember that we call this the descending aorta, but it has sections to it. So there's technically the thoracic aorta and the abdominal aorta. So when you look at the abdominal aorta, you'll see that, again, there are several branches that are going to come off to basically have blood supply to various organs. So for instance, you'll see the hepatic artery that's going to give nutrients and, again, deoxygenated or oxygenated blood to the liver. You're also going to see the splenic artery that's going to give blood to the spleen. When we look at the stomach, there's actually what's called a right gastric artery. And then we have these arteries that are going to give rise to the kidneys called the right and left renal artery. And even to the actual adrenal cortex, we have the suprarenal arteries. So we have lots of different areas that you're going to be able to see. But again, I wanted to show you that that aorta is very large. And again, it will have different divisions to it so it can branch. And finally, when the aorta finally terminates, is when it hits the groin region. And what's going to happen is this common split, we call common. Anytime you see like a Y or a split, we refer to it as the common. This gives rise to the right and left common iliac artery. And then that will go down into the lower extremities. So just something to sort of look at and to be able to start thinking about. And again, we're able to see that right and left subclavian artery, that they're going to give rise into the upper extremity. So we'll see from the subclavian that will go into the axillary artery, the brachial artery, and kind of move on from there. All right, now when we look at the arteries of the head and neck, remember that we have that common carotid artery. And again, if you see common, it's going to tell you that it's going to split. So what happens here is you have the common carotid artery, and as you can see, it makes this little division here into the internal and external carotid artery. The internal carotid artery is going to go more into the face and kind of go more into like the brain and head region, versus the external stays more on that superficial aspect. So when you go to look at these again, the way that I always kind of remember it is that internal is going to go more internally. It's going to go more inside to the face versus the external again stays more on that superficial. And as you can kind of see how it's surrounding around. But again, this wide split is called the common carotid artery of where this is taking place. And you can also see that subclavian artery that's coming off of here. So remember, there is a right and left subclavian artery. It's just how they look on the heart that there's a little bit of a different split or division to go along with it. All right, and then looking at the arteries of the head, neck, and brain, I'm not going to actually ask you about any of them in particular, but I do want you to know that there's something called the circle of Willis that actually joins these arterial systems together. So it joins the carotid and it also is going to join the vertebral arteries together. So it's going to give rise to the blood supply for the brain. Now, again, if we were to be in a little bit more of a higher level anatomy class, we go into detail about this, and especially like where potential strokes could lie and where that hemorrhage can occur and where there could be some functions that are kind of go out in lieu with the nervous system, so are in cahoots with the nervous system, but that will be for a different class. All right, but we do have to think about the upper limb. So again, when we think about the upper extremity, we're going to originally start with that subclavian artery, and subclavian gets its name because it's going to be at that clavicle region, and it kind of goes underneath the clavicle when you're starting to look at it. So again, it kind of starts above and then it'll go below. And when it goes underneath, we're going to hit something called this delta pectoral triangle, and that's where the axillary artery is going to come off of. When you go to look down, you're going to see that we're going to hit the brachial artery once we hit this humerus. And when you look at the head of the humerus, or actually looking at the neck, you're going to see that there is something called the circumflex artery that sort of surrounds it. There's an anterior and posterior humeral circumflex artery that comes off of it. And again, this has to give blood supply to that bone too. That's very important. And then again, we have the brachial artery, but we're also going to see not only do we have the brachial artery, we also have something called the deep brachial artery that is going to supply more of those deeper muscles and again, deeper tissues. And then when you finally look at the kind of the split to where the brachial artery is no longer going to be named that, what you're going to see is there's going to be the split between the radial and the ulnar artery. Now, the ulnar is going to go to the side of the pinky versus the radial will run the side of the thumb. And then there is another artery that sort of surrounds them. They're called the recurrent arteries, but I will not be asking you about those. And then finally, when you hit the hand, you're going to notice that there are these arches. So there is a superficial and a deep palmar arch to give rise and again to give nourishment to those carpal bones, but also again to allow for these digital arteries to take place. So again, that way we have oxygen not only going to the top of our head, but to the tippy top or to the tippy little parts of our toes and fingers. So really important there. All right, now to also keep in mind as well that we do have to have arteries that are surrounding the thoracic wall. So again, when we think about that aorta, it's the descending aorta that's going to give rise to that thoracic and abdominal aorta. And around the rims, around the ribs, you're going to see that there is these intercostal arteries. There's an internal and an external costal artery that is going to, again, help with breathing and helping with these motions of the muscles. And again, they're going to kind of give off to that thoracic wall, and several different blood vessels are going to be used here. Now, when it comes to the pelvis, again, you got to think about that descending aorta, that we had that thoracic division, that abdominal division, and again, we have the split at the common iliac artery. So there is a right and a left common iliac artery. And again, when we have that split, now we're going to see that there's actually an internal and an external iliac artery that we're going to see. So again, we'll see that little rise that's going to be happening. External goes more superficial, internal is going to go more towards the organs. And so when we think about the common iliac artery, this is the blood supply to the pelvic organs, the gluteal region, and even to the lower limbs. And again, it divides into that external and internal iliac artery. And then finally, again, when we're starting to look at these kind of pieces, again, you can see this abdominal aorta, we see this common iliac artery. And again, we're going to see this split between the right and the left to where we're going to have an internal component and we're going to have an external component. So here again, you can see this internal, you can see the external going more towards that sacrum, sort of inward as the internal. And then what will happen is we're going to have this name change at the femur called the femoral artery or femoral artery. And again, like there was for the brachial, there was a deep brachial artery. There is a deep femoral artery as well. And again, this will run the length of the leg. And eventually what will happen is we're going to see sort of these splits that take place that will go to the anterior tibial artery. There's a posterior tibial artery. And then there's also a fibular artery that runs on the posterior aspect. Now looking from posterior, if it's in the back, we still call it the femoral artery while it's in the thigh, but it is going to do a name change when it hits the knee. And this is going to be at the popliteal artery. So that's the posterior aspect of that knee. And again, we're going to see the anterior tibial artery give rise in the front. We have the posterior tibial that's going to give rise in the back. And again, we get that fibular artery off to the side in that lateral view. And then like how we had that deep and superficial dorsal arch, we do have this arch as well, but we call it the dorsus pedis. And this is one of the areas that you would look for a pulse. Now on the venous systems, the names are pretty similar. There are going to be a couple changes to make mention of, but otherwise naming wise, they're pretty similar. And again, from the venous system, you got to remember that they're mostly going to be carrying deoxygenated blood, which is why we see them in blue, except for again, on those pulmonary veins that they're giving blood back to that heart. All right, a couple of things to think about in terms of the venous pathways. Again, the whole goal is to return blood back to the heart after this gas exchange, and also the waste between the blood and the cells. So from a pulmonary perspective, again, the veins are carrying oxygenated blood back to the heart to then go out to that systemic circulation. But through systemic circulation, again, when we finally are getting those veins to get blood back to the heart, it's deoxygenated and there's a lot of gas and waste products that are going to be there. So what will happen is, again, you have vessels in the venous system that are going to be from the capillaries and they merge into the venules, and then venules become smaller veins, and eventually they hit larger veins. And the largest vein that you're going to see actually has two components. It's a superior and inferior vena cava, or inferior vena cava, depending on singular or plural sort of talking. But anyway, the superior and inferior vena cava actually return the blood back to that right atrium. So all of the veins converge into this one area. And again, it's going to dump it back to that right atrium. So one common thing that you're going to see that's different is instead of having a carotid vein, we call it the jugular vein now. So there is a name change here that you're going to see. So there's a jugular vein, and there can be an external and an internal jugular vein that you're going to see. The external jugular vein, like what we see here, is going to drain blood from the scalp and the face and the more superficial aspects, versus this internal jugular vein. And if you notice, it's significantly bigger. This is going to be from the deeper portions of the face and the neck, and also from the brain as well. And as you can see, they're going to come down and they're going to converge at something called the brachiocephalic vein that gives rise to the axillary vein. All right, so when we talk about these veins, again, we're thinking about sort of working our way backwards. So again, we're taking blood from the tip of our fingers back to the heart. So if you think about it, you have your digital veins that are going to be coming from the fingers. We get the radial and ulnar veins that are carrying things back. And then we have to go to the brachial veins. Now, when we talk about the brachial veins, again, you're going to kind of see that they're coming from both sides. There are a couple other veins that I want to show you as well. One very common one that we utilize in phlebotomy is the median cubital vein. And so again, this is usually where blood is drawn, because that's a pretty good vein spot. But you're also going to notice what we have are called anastomoses. And this is sort of a network of blood vessels that are working together in the palm and the wrist. And they're going to give rise to the basallic and cephalic veins. Now, the basallic vein is going to join the brachial vein. The cephalic vein is going to join the axillary vein. So just to kind of show you, to make a little bit more sense of this. You have the subclavian vein up here. You're going to see that again, you have the axillary vein going more towards the armpit region. And then we have the cephalic vein. And again, the cephalic vein is going to basically join that axillary. But what we see with the brachial is that's going to come in to rise with this basilic vein. So we have the brachial veins here. And again, they sort of converge with that basilic vein. Again, we got that median cubital vein going on here. And then again, we have those radial and ulnar veins. We get this dorsal arch, and then again, we get these digital arteries coming down. But again, we're sort of working our way backwards. We're taking blood from the tips of our fingers back into circulation, back to the heart. Now, one thing I do want to show you as well, not going to really ask you anything about the abdominal walls because this is just a little bit different, but and where you see the superior vena cava and you also see this inferior vena cava, what you're going to notice is that superior vena cava has the subclavian vein and the brachiocephalic veins that are going to come off of it. So that's a little bit different. And again, when you see the subclavian vein, now again, you can see that axillary vein. And again, you can also see that cephalic vein that's running through. It's just something interesting to look at. When we talk about the veins within the abdominal viscera, as we talked about before, you have that abdominal aorta that gave rise to all those different branches to nourish the organs. Now what we're going to be dealing with is something called the portal veins, and they're a little unusual, but they don't necessarily directly transport blood back to the heart. And in fact, we actually use this system called the hepatic portal system in the abdominal viscera. And what they're doing is they're transporting most of the blood to either the spleen and to the pancreas, and it's going to drain into this part of the liver that's going to process it before it goes back to the vena cava. So we have a little like alternate pathway that you'll see. And that's actually what we're noticing here is that we have this hepatic portal vein. And again, it's going to transport it to the liver. We're going to make sure that everything is good to go. And then it can finally go back out to that inferior vena cava and go back to the right atrium. And so when we think about the portal systems, especially the hepatic portal system, the idea is that you're filtering blood. Now, we also have this in the renal system as well. So we're going to talk more about that coming up very soon. But basically what it's going to do is it's going to perform a unique function in the body to really help with that filtration. So instead of it being where it only has one set, like normal, it's actually going to have two sets of capillaries. So that way, again, it can really help with this idea of filtering the blood. And that's the ultimate goal is you want to filter it, make sure everything's good, and then it can go back to the inferior vena cava and go back up to the right atrium. Then when we start looking at the veins in the lower extremity, again, pretty similar. You're going to have the external iliac vein or the kind of that common iliac vein, and then it'll branch off to the external and internal iliac veins. But what you're going to notice is we have a superficial set of veins too, called the small and great saphenous veins. And the small and great saphenous veins are actually utilized when someone has like open heart surgery and they have to have a replacement. A lot of times they will use this as a way to do a bypass surgery. But you still have that femoral vein that you're going to see running down. You still have that popliteal vein, so that didn't change. Still get the anterior and posterior tibial veins. But again, this new kind of interesting one is the fact that we end up with these superficial veins that are going to be the small and great saphenous veins, and they run the whole length of the foot. So they go from, extremely high up in the thigh and they run their way down. All right, guys, I hope you're having a wonderful day. If you have any more questions, feel free to ask. Thanks, guys.